So my name is Jemma and I'm the Clinical Network Lead for the Adolescent Transition Care Clinical Network with the CIH. So adolescence is a wonderful time period of life that we all go through. It's defined in different ways, but adolescence starts at around the time of puberty, so around the age of 10 to 12, and usually concludes in the mid-20s. But we know that the brain developmental changes occur over even a longer time period than that. Adolescence is a time when the physical body and the brain are changing and the social role is also changing. So it's a really wonderful time. Adolescents have so many wonderful ideas, ways of thinking about the world, and they're a really valued part of our society. Adolescent transition care is the planned and purposeful movement of young people with a chronic illness or other healthcare needs between, so it's when they're moving from paediatric focused care through to an adult healthcare service. So although some people might think of it as just the transfer point of moving from paediatric to adult services, it's actually the time where we prepare a young person for the move through the service. We help develop their autonomy, their health literacy, and their ability to make their own decisions as developmentally appropriate. And then as they move through the system, we then welcome them into adult health services to continue with their healthcare needs. It's really important that services for adolescents are designed with them and that they have a really good say in how their healthcare is delivered, because they're the most important part of that journey. The Adolescent Transition Care Clinical Network is comprised of people throughout the state who have a vested interest in adolescence. The network aims to improve the way we deliver healthcare to young people in South Australia, and we would like as many young people to input into what we're doing as possible. Right now in South Australia, there's a lot of opportunity to improve the way healthcare services are delivered to adolescents. And there's a lot of opportunity for them to have a say in how that healthcare is delivered. What we want to achieve is healthcare for young people that is what they want. It's designed how they'd like it designed, and then it means that whatever healthcare issue they're having doesn't impact on their normal healthy adolescent development, but rather works around it to support them. Adolescent transition care is important for several reasons. The first and foremost is that adolescents are an important part of our society, and we need to support the way their healthcare is delivered and make sure it's targeted to what they want. The other part is that investment in adolescence pays dividends into the future. So young people will become adults, and if we have provided them with respectful and appropriate healthcare during that time, they'll stay connected to the health system, they'll become healthy adults, and they will become leaders into the future.